I'm
Yes.
doing okay. Yeah. Why can't you just tell me what's wrong?
Uh,
Seriously, like
I see.
I take my dog into you. I'm like, my dog's got a limp. What's wrong? Why can't you just tell me what's wrong?
You'll understand exactly what your vet is doing with all those tests, why it takes those steps, and how to walk in and cut the guesswork in half by contributing to the information that your veterinarian needs. Welcome to Positive Health, where we believe that pet owner education leads to better pet health. My name is Dr. John Adam, and I'm joined here with my co-host, a fellow pet owner, Devlin.
Hey,
Um, and just a reminder, friendly reminder, that any and all information in this video and on this channel in general are for informational and educational purposes only. They should not be used for diagnosis or treatment advice for your pet. Please contact your veterinarian for your specific pet health needs. All
you know what
right,
really grinds
Devlin,
my gears,
how you
John?
doing?
All right, but I mean, you've obviously been doing this for a little bit of time now, so you can't just look and diagnose. What's wrong. Like, what can you look at and diagnose, or can you?
So, I mean, there's obviously some things that are going to be obvious once we walk into the room, such as your dog has a cut or has got bad dental disease. We can look at that and see that. It got stung by a bee. So, we know that by you guys rushing in and saying they got stung by a bee and they're, swollen their muzzle and all that stuff. So, there are stuff that's going to be obvious, but unfortunately, a lot of the stuff that comes in through the doors are internal issues. And unfortunately, we as veterinarians don't have microscopic eyes or radiographic eyes where we can see inside. So we do need to see what's going on by doing specific tests. And the signs that are seen, such as vomiting and diarrhea and all that, are just signs. They're not a specific diagnosis. In fact, those signs can lead to multiple diagnoses. Like, for instance, vomiting can have 50 plus things that can be causing that, from a foreign body in the gastrointestinal tract to a dog that's dizzy because it has vertigo, or pancreas issues, kidney, liver issues. So you've got a bunch of stuff that can be caused by a very vague sign that we need to, through diagnostics, rule in or rule out those problems.
But even something simple and innocuous, like the dog has a limp. Like, how many different things could a dog with a limp actually be?
Yeah, and that's a good question because, yeah, a dog with a limp can be a multitude things. Obviously things like a stress strain injury, to a torn ligament, to a fracture, to up to cancer. So we don't know unless we, once again, put our hands on the dog, for one, but also um, a lot of times have to do those diagnostics to see what's going on.
All right. And I'm assuming that the majority of the reason why it's difficult for you to assess is you can't ask follow up questions for the animal. You've got to ask the human, which may not really be that good of a witness.
Yeah, and that is one of the difficult parts as for our profession, is that a lot of the stuff is secondhand. And in human medicine, you can ask the patient directly, like, what hurts, what's not feeling well, what's exactly happening. Well, we're getting it from the owner, who's just observing certain things, and they're thinking it's one thing when it could be something else. Like, they're thinking their dog had a seizure, but we end up finding out it just has vertigo and it's falling over because it's got vertigo. Or it's they're thinking that the dog is choking and actually is having reverse sneezing. So a lot of the secondhand observations we have from the owner can be misleading sometimes, and that kind of makes it difficult. And unfortunately, our pets can't really talk to us and show us exactly where things hurt or feel bad or whatever it may be. Also, pets are very good, especially cats, at hiding things. especially when they come into the veterinarian. Their adrenaline's going crazy, and the once limping dog or cat's like, nope, I'm fine, everything's good. I'm around, see, everything's great, because it's their instinct to hide things. Because in the wild, obviously, if they show that they're hurt, they'll get eaten. So they will instinctually hide things, even for weeks or months sometimes, until they can't. Um, Once again, it's kind of hard to localize, where they're in pain. I mean, we could have a dog or cat that's painful in its abdomen because of something, but then its back is hurting, or vice versa. Or they're just reactive in general because they just don't feel great. And so they look like they're in pain everywhere, but it's just because they're just not feeling great. So all that kind of makes it very difficult for us to localize and figure out exactly what's going on, just by the history from the pet parents, as well as even our physical exam.
I mean, I really shouldn't be too surprised. We go through the same thing in my optical clinic when somebody comes in with a pair of glasses and they just toss them at me and say, "Hey, what's wrong with these? I can't see out of them." Like, I have to ask them a lot of questions. They don't really know what's going on with the glasses, and it could be something, you know, simple. It could be something that's really difficult. So, in my own way, I'm having to go through a bunch of tests. So I kind of get it, but it's not really something that we're used to. Like, we're thinking of it like ourselves as the pet parents. Like, I go to the doctor and I'm like, doctor, like, my foot's sore, and
Hmm.
he's not going to send me for an X-ray, an ultrasound, a podiatrist, and all that. Like, he's just going to take a look and be like, yeah, it's this, and send me on my way. May not
Yeah.
necessarily be accurate, but like, that's what we're
Yeah.
used to for ourselves. So I'm sure that's why, like, a lot of us as pet parents are expecting that instant gratification, right?
Yeah. Yeah.
And if you're going to be in there doing a quick 5-minute exam with your hands all over my dog and putting that stethoscope against his belly and checking his temperature in a
It's
really uncomfortable way. Like, what are you getting from that quick examination that you're doing?
So, even though it's quick, obviously a lot of us have been doing this for years, and we're able to gather a ton of information even in that short amount of time. I mean, we're, you know, looking at their temperature and their pulse rate and their respiratory rate, to make sure that we have baseline vitals, to make sure all that's okay, make sure they don't have a fever, they're not having a high or low heart rate, or even respiratory rate. Now we're looking at their gums, checking the colors, make sure they're pink and not yellow or white or blue. We do this thing called a or capillary refill time, where we actually, with our thumb, blanch out the gums and release and see how quickly it fills back up with blood, and that kind of determines, maybe there's an anemic process or a circulation problem. We listen to the lungs, their hearts, see if there's any murmurs or harsh lung sounds or rhythm problems in the heart. We feel their abdomen to feel if there's any foreign bodies in there, or enlarged organs, or pain, discomfort. Check their lymph nodes, the ones that are external, obviously. See if there's any enlargement or abnormalities there, because that could be a quick sign of an infection or maybe even cancer. We check their hydration status, we check their skin, their eyes, their joints, if they're limping, their overall demeanor. So there's a lot of information that we can gather with our physical exam, even though you think we're not getting much out of it because we do it in 5 minutes, but we're trained ourselves enough to kind of, even while we're talking to you guys, we're looking at the pet and seeing what's going on, and just kind of recording it in our minds as far as what we think the problems are, along with all the problems that you mentioned coming in. And then from that problem list, we can then say, okay, we think maybe we got this, this, and that. And then from there, we will formulate usually a diagnostic plan to try to rule in and rule out those probabilities of what we think might be going on. But yeah, no, physical exam gives us a lot of information. In fact, usually out of the history and the physical exam alone, we can a lot of times narrow things down to like four, maybe 3 to 5 things, basically, what can be going on. And that way we can kind of tailor our diagnostic plan for your pet.
So, you're getting all of that, and you're tailoring it down to a few things from our pet. I'm assuming then the baseline is coming from prior exams, right? Like your
Prior
wellness check for the
exams,
year.
yeah, exactly. Prior exams obviously are um, um, us looking at normals over and over and over again helps a lot. Um, and so with that, we can once again formulate another list of problems that we're seeing, along with, I guess, the problems that the client is mentioning to us, and via that we can formulate a diagnostic plan because of what we think might be going on. But fortunately, with just a physical exam, a lot of times that's not going to tell us what's going on. It's going to be the diagnostics that we run that's going to tell us what's going on. I mean, we can't look at a pet and say, oh, it's creatinine or renal values are, this level, or hey, there's a tumor in the lung right there, or we don't know its blood sugar just by looking at them. So that's why we need to do those diagnostics to see, what exactly is going on, how the function of the organs are doing, what exactly is going on internally.
So, what else can't you see from that examination aside from like you said the creatine levels and if there's a tumor, right? Because those are blood and imaging. So, what else can
Yeah.
you tell from that examination?
I mean, there's a bunch of things. I mean, like, if you're worried about the eyes, I can't tell you what the pressure is in a dog's eye just by looking at it, or um, I can't tell if there's like sometimes we can tell if there's like an intestinal foreign body, but sometimes, a lot of times, they're so painful and guarded that we're not going to be able to feel it, or we may have a hunch that something's going on. So once again, it's just we can't determine, function of an organ, or like I said, like a mass inside a lung, or how big that heart is just by listening to the heart, um, without some diagnosis, some imaging, some lab work, and all that. So
All right. So I understand why we're doing the tests because you want to get the more concise picture of what's going on, not just the broad observation from the initial examination. But you send me in for an X-ray, maybe some blood work, urine and stool, and then I come back the next day and it's another round of tests. So why not ask for those other tests all at once? Why it feels like on a pet parent side, it feels like you're over testing us.
hmm. That's a fair question, and it may seem that way, but honestly, if we did everything under the sun right off the bat, like we're an episode of House, I mean, that'd be great if we could do that, but honestly, a lot of times it's not necessary. It can be more, discomfort to your pets, and may be more invasive than it needs to be. And also, the cost would just be enormous. I mean, as you know, cost of diagnostics and imaging are expensive enough as it is, and to
Yeah.
want to do everything under the sun, even if it's not warranted, would just increase the cost so much that no one's going to be able to do it. And we also got to keep in mind that we also want to do treatment, and that's going to cost too. So we have to um, weigh what is going to give us the most answers as far as if something's going on or if something's not going on, and narrow down that list so, as quickly as possible, without wasting your time, pet's time, our time. And so there's a lot of downsides if we just kind of try to do everything at once. Um, I mean, I did pet today that uh, dog came in very vague, just not wanting to eat. Um, and when I felt his abdomen, he was very painful. And so from there, I was like, there's something going on in there. So let's take some x-rays. Now, could have asked for, blood work and ultrasound and CT scan and all that stuff. Yeah, sure. And it would have given me some answers. But via the x-rays, I was able to see, oh, no, we have a tumor in the abdomen. And then we also did some x-rays of the chest and found out that there was also issues in the test that looked like cancer. And so via that one test, we got our answer. I also tell people a lot of times, as far as doing diagnostics, if it's not going to change the treatment or the outcome of what you're going to do, then there's really no point in doing it. So only do things that will kind of change your treatment or plan for your pet, basically.
So basically, what you're saying is, if I bring in a car to a mechanic and the pistons have blown out of the engine, I'm not going to also ask them to check the levels of the windshield wiper fluid.
Yeah, or reupholstery
Yeah.
the inside. Yes.
Okay. So along the lines of hiding it, can their blood also hide that they're sick? Like, is their blood going to come back normal when they're actually
That
sick?
that does happen a lot as well. And once again, I'll have pets that are extremely sick, and we run blood work, and it's squeaky clean. And then we'll run it again later because we've done treatment and they're still not doing well. Run it again a couple of days later, and then all of a sudden they have raging pancreas issues or their kidney values go through the roof, and it could be that the values just didn't catch up to what was going on in their body, and that does happen. Sometimes X-rays or blood work are just a step behind. And so we won't see the issues until a little bit later on, unfortunately, after the signs have started. And so a lot of times we will repeat, blood work or X-rays to see if there's any changes. We've got, that baseline from before, and now we repeat it again to see if there's any changes. And sometimes that does happen.
Yeah. Well, I remember, what was that, like a week or so ago? Loki, my dog, seemed absolutely fine. And then that morning, he seemed sick. And, one of the things that you told me, and I've heard it many times, so I know how to react. But, what you had told me was, let's try this and see what happens. And it was, I think it was some in-house medication. Was it, wasn't Prilosec? Was it Pepto?
That's right. I wanted you to do Prilosec because I was already
Prilosec.
had an ulcer, which
Right. And the response was, all right, let's try
so.
this medicine and see what happens.
Yeah.
And that's, while I love you, I've known you a long time, that's a hard pill to swallow. Not just to get him to swallow, but it's a hard pill to swallow.
Yeah.
Of, let's try this medication and see what happens. It's that let's see what happens that's hard to hear. So I'm going to ask the question that a lot of pet parents are going to ask. Why can't you be straight with me when it comes to that? It just feels like a guess, like I'm just throwing darts on a wall and hoping I hit the right diagnosis.
Yeah. And so, no, a lot of times we're sometimes using therapeutic trials, is what we call it, as a diagnostic. So we're not doing it just a shot in the dark. We're actually using it as a tool to, once again, rule in or rule out the more common things that can cause whatever it is that's going on. Like in your case, your dog was having, vomiting and diarrhea and all that. So another case in point is if you think a dog has a food allergy, we'll do a food therapeutic trial with a hypoallergenic food to see if we do have a food allergy. So we're using that therapy to see if we've got an issue. So, and then when we see that's either positive or negative, then okay, well, then we go to whatever direction that points us. So
That's
now a
that
lot of times,
elimination
and
diet we were talking about, right?
yes, yeah, elimination diet and our food allergy video, which you
Yeah.
guys can see in our channel list as well. So, um, but but yeah, it's you know definitely a very good diagnostic tool. Sometimes are therapeutic trials to see what's going on. Because I mean, if we um, guessed right as far as it being one of the more common things, then the diagnostics showed what it was, but it also treated it at the same time, and so it's a win-win. But if it doesn't, then we go into more specific testing and all that stuff that will see okay what else can be going on.
And then a lot of times when we're doing these things, it's the response that we're told right away is of like, all right, let's do this. It's well, and if things don't improve or if things get worse, just let us know. Well, aside from just asking how long do I wait before I let you know if things are worse or not getting better, are there other things, that we should be asking you when we're agreeing to these treatment plans, this therapeutic treatment plans?
I mean, obviously, you should be asking us what we're thinking is going on and why we're suggesting the treatment that we're suggesting. But yeah, another thing is obviously, like you said, how long should we wait? Is there any, even if it didn't really work, is there any differences? Did it get a little better? Did it get a little worse? Um, the let us You should also ask us what improvement means. Like, should we see a complete 360 and they're completely better by tomorrow, or no, this is more for slow progression as far as the the treatment will kind of slowly help your pet versus being something right away. Like when we give an anti-nausea medication, that might be something where by the next day I don't want them vomiting anymore. Or if I'm giving him pain medication, like it may take some time because they have to kind of heal and recoup and all that. So it may take us a week to really know what's going on. So time frame matters. What improvement looks like matters. And then from there, if we do have improvements or not, what are the next steps?
So I do all these tests and everything comes back normal, but my dog or cat is still sick. I basically have a nothing result. Um, did I waste a bunch of money?
No. So I I actually love having normal tests come back because obviously we're testing for things that like kidney issues, pancreas issues that can be pretty big things. So when we have tests that are negative, that actually helps us a lot in narrowing down what's going on. It will rule in or rule out a bunch of things. Obviously, if the test is negative, it rules out a bunch of things. So it helps us narrow down the list as far as what could be going on, and it also helps us to direct where we need to go next. So normal tests is actually a lot of times a great thing, and having normal tests is not a waste of time, not a waste of money, but definitely is a big help a lot of the times.
All right, fair enough. And it's not just a way of you finding out like something else that's going wrong with the dog.
Yeah. No, yeah. I mean, like I said, if the tests are normal, then um, it could lead us to a different direction versus okay, we shouldn't be going this direction. It's going to lead to a dead end because everything looks okay at this juncture. So
And I know we talked about it with the dental video that we did. But when we do anesthesia on our pets, like that's a big one that a lot of us are really hesitant to, especially with our older animals.
Hmm.
So if I, have a sick animal, I'm going to be a bit hesitant to find out that I have to have it sedated just to get,
Hmm.
an x-ray or imaging. So
Yeah.
why can't they just be held still for, these pictures?
Yeah. So, I mean, a lot of times we can. A lot of times we're able to do what we need to do without sedation, but sometimes pets are don't cooperate, and also they're very stressed out and being sick. If you're sick and stressed out, that obviously doesn't help things. So sedation not only helps us get what needs to be done, but it protects your pet. It protects our employees as well, um, and it lowers the stress of coming into the veterinarian and getting these diagnostics done. Sometimes we need to get a more thorough look at something, and being awake unfortunately is just not going to cut it, and it's going to be either too painful or your pet's just not going to tolerate it, and so sedation a lot of times will help calm that patient down enough so that we can get what needs to be done.
What are you talking about? Harley was an absolute angel. my calico cat for our watchers. Uh,
Yes.
Absolute angel. She was never terrorizing the staff or a danger to the staff.
Oh my god.
Okay, so aside from all that, um, realistically, we're frustrated, we're hurt, we're scared because of what's going on. But we're only going to get to a solution in a fast way if we're also giving you um, the right information up front. So
Hmm.
um, what is it specifically you want us to bring to the table, the exam table? Do you want just like a Ziploc bag full of poop, a mason jar full of pee, and you know the
So
food that they've had the last week? Like what
yeah.
do you want? What makes
No,
your job easy for us to do?
I mean, all of it, as much information as we can get from you guys. I mean, say the dog has been limping. If you could take a video of it, show us them running around and walking around. Let us know, when is it better, when is it worse? How long has it been? The frequency that things have been going on for. Uh, Bring us a timeline. Let us know exactly what happened at what time. If you're having an issue with, you know, a specific, diet or medications or, sleep preventative or something of that nature, bring that in. Let us see the labeling. Let us see what has been given to your pet so that we know exactly um, what we're looking at. If you can't bring in the actual package, take a picture of it. Um, like you mentioned, bring up a poop sample. If your dog has diarrhea, bring us a sample. That way, we don't have to fish out of your pet if we need to run a sample for them. So it's a lot less stress for your pet there. If your dog vomited up something weird, bring it in. Let us look at it. So as much information as you can give us during the initial history can honestly give us so much information where we don't have to run as much diagnostics. Um, we don't have to do as much guesswork. And so that can help a lot, not only in the cost of what we need to do for your pet, but decrease the amount of time your pet's going to be staying with us in the hospital, less stress, better treatment, and so just better overall visit, basically. Um, Even if something you think is embarrassing, to tell us like, oh, he's got into my marijuana stash, or I'm sorry he got into this medication or whatever it may be. I mean, we honestly don't care. we just want to take care of your pet as best we can. So all that information, we're obviously not going to take it personally, but we're going to use that, and hopefully it's going to help um, take care of your pet. So please let us know everything and anything that you can give us, even things like how much food they eat on a daily basis, or even how much water they take in. Has that changed at all? Um, and let us know from the beginning, what is your biggest worry. Don't just tell us a bunch of different things that's going on, like, oh yeah, he's been bombing and he's also scratching his ear, and then there's this little lump that it's been there for a few months. It's like, okay, we got a billion things going on, but why exactly are you here today? Yes, we'll assess those things, but we want to address the biggest problem that you and your pet are having. So be direct. Let us know what's going on. What is most concerning to you right off the bat?
You make the observation sound so simple. What do you expect us to just have, like, a camera, a notepad, and a clock with us at all times?
Right, exactly. Yeah. Yeah, I mean, it's so
Uh,
much easier nowadays to just
yeah,
snap a photo or take a video. I mean, like I said, big things are like a limping dog, or unfortunately things like seizures. If you guys can get
yeah.
us videos on that, and we can definitely give us a lot of information on what's going on. If you can just get us a video of what's going on.
Now, I personally have some very strong opinions about the use of this next question, but um, a lot of our fellow pet parents are going to be looking to Dr. Google and Dr. Chat GPT, or one of the other
Hmm.
AIs that are out there, because quite frankly, you know, it's cheap. Like that.
It
That's
is.
from our part. That's the reality of it. It's cheap, but as we know, like the old thing from like when we were kids, it was like, oh, I'm feeling sick. Let me go to WebMD and put in my symptoms. Oh, look at that, I have cancer.
Right. And that's the thing with things like ChatGPT or Google before ChatGPT. I mean, it's still obviously a big thing, Dr. Google. Um, it can be a very good resource as long as you're looking in the right places. But it could also um, lead you astray very quickly, because there's a lot of bad information out there. There's a lot of great information, and your veterinarian can definitely point you into areas where you can find really good information about your pet on specific issues and um, whatever it is that you're wanting information on. But there is a lot of bad information, just like with anything. And your veterinarian is trained to kind of decipher and narrow down what is true, what is not, as far as what's going on with your pet. Now, with Google and ChatGPT, I mean, you could get a list of differential diagnoses for whatever problem your pet's having. But that's about it. Your Google or ChatGPT can't put hands on your dogs, can't listen to their hearts. ChatGPT doesn't know that, hey, we've been having this issue with this certain respiratory bug for the past week, so maybe that's what's going on with your pet. Or obviously doesn't know the region that you're at, so is there specific things in your particular area that's causing issues that are related to the signs that your pet's having? So there's a lot of factors that Google and ChatGPT can't decipher, and so they're just going to give you a list of any and all things that can cause vomiting. Unfortunately, a lot of times pet parents come in because they're worried because my dog scratched its back end, so it's got a tumor on its back end, or it's got cancer or whatever it may be. It's like, no, let's not go that far. So I mean, I guess it gets them in. So not, I guess thank you, Dr. Google, for bringing the patient in, but there is definitely a lot of misinformation out there that your veterinarian can decipher through, and so you use your veterinarian. They're there for a reason, and once again, they're able to put hands on your pet, take a look at your pet, and through that, they can say, okay, with these specific problems, this is what we think may be going on.
Yeah, we see it in the optical clinic as well. Pretty much the same thing of someone coming in. I've told a lot of our patients that Google and Chat and the other AIs, they're a fantastic resource for anecdotal evidence, not necessarily evidence specific to you, but good
Yeah,
anecdotal evidence, just broad generalizations for what's going on. But I mean, that's pretty much how they're designed. It's how they're going to keep you engaged. But
yeah,
I think like the major difference and the reason why like a lot of us as pet parents will keep going is, you know, it's always going to give you an answer. It may not be the correct answer, but it's always going to give you an answer.
hmm,
Whereas there's been times, we come to you guys and it's, hey, what's wrong? And you just, you've done some tests and you're looking at it and you're like, I don't know. So like when is that actually okay if our vet says, I don't
yeah.
know?
I mean, it's always, I think, okay. I mean, there's going to be points where we're stuck, and we need, a second set of eyes, or we need maybe a specialist to take a look at someone that's, they're specialized in that particular field, whatever it may be, to take a look at your pet. It's good if your vet is honest and tells you, like, hey, we've done all these diagnostics. I still don't know what's going on. I need another opinion from, a specialist, an internal medicine specialist, a dermatologist, a surgeon, whatever it may be. And it's good when your vet knows their limits, and doesn't keep, trying different things and using different diagnostics to see what's going on, and just kind of, um, doing things just to kind of try to figure things out, but they honestly don't know what's going on. That's not, proper medicine. And so when your vet is saying, hey, we need extra eyes on this, or another opinion, or may need to have diagnosis done that their particular facility can't do, like an MRI, or a CT scan, or a specific thing like an endoscopy done that they can't do at their facility. So that happens a lot as well. So having been referred to a specialist, or another doctor for a second opinion is never a bad thing, and you should applaud your veterinarian for being honest with you.
So being honest on our side as well, saying the quiet part out loud. Um, these tests are expensive, and
Yes.
sometimes the decision on even running some of these tests comes down to a financial one. So,
Mhm.
is it beneficial if from go we tell you like, listen, this is what's wrong with my pet. I got like $40 to my name.
Yeah. So yeah, no, I mean that helps us a lot, even though it can be frustrating at times. You being honest as far as what you can and can't do, um, helps us a lot. I mean, from the get go, we can say, okay, we're always going to present, the gold standard. What if there's no issues with, spending or costs or anything, we're going to present, the gold standard for you. What's the optimal thing to do? But if you are unable to do the optimal thing, I mean, most veterinarians should be able to adjust to what you can do and figure out what they can do to best take care of your pet with the resources that you have. And sometimes that can be difficult, especially, things are very expensive nowadays. And so sometimes they can't do anything other than maybe a therapeutic trial. Or sometimes they can't do anything. And so maybe the best thing for your pet that is suffering is potentially, put them down or whatever it may be. So knowing that right off the bat, that way we're not ring a bunch of diagnostics and doing all this stuff, and now you've got this huge bill and you can't do anything. That is a little more frustrating than knowing right off the bat what you can and can't do. Obviously, you've got to have expectations and knowing, okay, your veterinarian wants to do all this stuff. I can't do all this stuff. So the treatments may not be optimal. And you got to keep that in mind and don't get frustrated when things don't work out, when you can't do everything. Because once again, because you can't do the optimal diagnostics and treatment that your veterinarian is proposing, the outcome may not be as favorable as if you could do those things. So work with your veterinarian, they'll work with you, and we'll try our best to take care of your pet with whatever's going on.
Budgetary wise, is there a singular test that tells us like the most information every time?
No, unfortunately, there's not. It depends on obviously what's going on. I guess the biggest diagnostic tool we have is our senses, our sense of sight and smell and touch and observation. That the physical exam honestly is our biggest diagnostic tool, but sometimes we're going to need more than that, and so one thing isn't necessarily going to tell us everything, unfortunately. And so that's why a physical exam is very important, because it can kind of tailor what exactly is needed to find out what's going on and not run every test under the sun.
All right. Well, I mean, I know like a lot of us have been, thinking about the test as a bill instead of a process. So we'll have to think about that. I really think that we should delve into more of what these tests are, but obviously that'll have to be another video. So we'll have to get everybody else to start reframing this for themselves as well. But I guess, the simple one is, use this little tool that we all have with us and start taking notes when our pets seem off, or even notes of, when they're healthy. We've got that school community with that free 7-day trial that we can have people come in and ask questions of you and talk with other pet parents. So we've got resources. Do you want to do the video next week of all of what these tests are?
Yeah, no, we can definitely go over in general. Obviously, we can't go over every single test, but we can go through the general ones and just what exactly we're looking at with those general tests, like a basic blood work or x-rays or an ultrasound or something of that nature. So we'll definitely go over that in a separate video. So so as far as for today's video, if you found this helpful or information was great, please give us a like and subscribe to our channel. Once again, Devlin mentioned the school community where you can join fellow pet owners in discussing your pet's health, as well as Q&A sessions with myself and other pet owners to ask your specific questions about your pet's health. And there's a 7-day free trial. If you like it, great, keep going, or if you don't like it, then you can cancel before that trial ends. Thank you very much, everyone, and we'll see you in our next video.
And don't forget to comment below if you have any ideas for another video in the future.
Yes, thank you.
Yeah. We'll see you next time, everybody. Take care.
Take care.